I hear my heart pumping and the music blaring in my ears. I hear the beats as I make each step and movement with the music. As I prepare for my next leap, I bend and shoot myself into the air. It feels like I am floating for a long time. Then I slowly descend to the floor and I hear a pop and feel pain in my knee. When I open my eyes, I am facing the wrong direction and completely out of sorts. I try to stand up, but I'm unable to stand on my own. As I take my first step, I feel instability and I'm unable to walk anymore. This was my first experience with an ACL rupture injury. Watching the 2014 Olympics makes it very prominent to the public how common sports injuries are. Hearing each skier, snowboarder, skater, or even bobsledder being announced with their possibility of medals, as well as their past injuries that have brought them to this point, show how normal these injuries are. High-impact sports, not being in shape, improper use of equipment, or poor training practice are, according to Medline Plus, the main factors that play a part in sports injury possibilities. These types of injuries, as defined by the medical dictionary, are injuries that result from acute trauma or repetitive stress associated with athletic activities that can cause or that can affect bones or even tendons or ligaments in your body. Each of these sports injuries are very, very treatable. However, they should be looked at under doctor's care. Now, who does this affect? Well, the short answer to this question is everyone. However, some are at higher risk than others. Children, according to Dr. Salerno, are at the highest risk of everyone for sports injuries because yes, while exercise is very good for them, their bodies are still developing, which can lead to various types of sports injury. As shown in this diagram, these are the men and women. These are the age groups. This goes from 0 and this goes to over 60. As you can see, these three groupings from ages 0 to 30 have higher injury rates than the older groups. Along with that, older adults are prone to getting sports injuries because while they are older and know how to play their sports better, they are still becoming less flexible and more brittle under certain conditions that leads them to being unable to heal as quickly and able to injure themselves more. Apart from age, women are more likely to get a sports injury than men due to their build and their body structure. So, while these injuries are at risk for everyone, they are at higher risk for certain demographics over others. Orthopedic surgeons specialize in injuries and diseases of your body's musculoskeletal system. These are the doctors that you go to when you first severely injure yourself in a way that may require surgery or in-depth medical attention. So in order to get treatment for these kinds of injuries, you must see an orthopedic surgeon. There are many different ways to treat injuries. For example, some injuries only require rebuilding the muscle strength through physical therapy, while others may require much more attention. For sprain injuries or broken bones, in most cases, all you require is physical therapy to rebuild the muscle strength and or casting of the bone or tendon in order to let it heal. For shin splints, a very common injury, it requires RICE, which is rest, ice, compression, and elevation, and some ibuprofen or some pain medication. For more severe injuries, such as ACL or meniscus tears in the knee, those injuries most of the time require surgery and a lot of physical therapy because they are unable to heal themselves in most cases. As you can see, all injuries are treatable in many different ways. However, there are ways to prevent these injuries from happening. In order to avoid acute injuries, acute meaning extremely dangerous and very common and very crucial to the body, or even a chronic injury, which is moderate pain or less crucial but still very painful, there are many things that you can do in order to prevent these things from happening. I will explain to you how to prevent each of these things from happening for each group that I have spoken about before. For children, it's a group effort by the parents and the coaches. Children are still learning how to maintain and how to play their activity, so they need to be trained properly with stretches and warm-ups as well as using the equipment properly. Along with this, children can be mindful in wearing the right protective gear, and they can learn how to use the equipment properly. For adults, you just have to learn how to play your sport properly. You need to maintain proper form, and you need to be able to stretch before each time you perform your activity. This is also an important thing to notice, is that as you get older, you need to respect your body's limits. So this is another thing to really look out for. For women, the main thing to do to prevent any sports injury is by staying in shape, conditioning your muscles, and building your muscles, and making sure you stay in a normal body weight. These few steps can really help with any sports injury from occurring. A few general tips for any age bracket would be able to help avoid bending your knee past 90 degrees when you are doing half knee bends, doing a warm-up, doing a cool down, and landing your jumps properly, and of course wearing the proper gear, meaning wearing the proper shoes for each sport. If you listen to these tips, you should be able to avoid most sports injuries and be able to prevent them from occurring. Sports injuries can be extremely painful and extremely crucial to the body. Having dealt with these sorts of injuries in the past 5-6 years, having 2 sports-related knee injuries, I really have learned how to take care of my body and how to focus on proper technique when doing my sports. Trust me, these prevention techniques that I've spoken to you about are worth following, because it is not enjoyable getting surgery and having to go to physical therapy multiple times a week. So, if you'd like to have more information about these sorts of injuries, you can go to the National Institute of Health's website, or just go to an orthopedic doctor and ask questions. There are plenty of informative websites as well that you could visit, or books in a bookstore or at the library, or even e-books online. So I hope I was able to help you learn about sports injuries, how the risks, the treatments, and the prevention of them.